Yeah, I mean, a lot of the focus in our previous legislative sessions has been about reducing the cost of our Medicaid program, not expanding it. And they're talking about, fraud prevention and things like that, which, there are some impressions of our Medicaid program in this state that certain lawmakers have that guide their decisions on these issues, particularly entitlement programs. I mean, can you guys speak to the utility of what these programs are actually used for and kind of, the way in which they might be misrepresented in some cases or...
In my prior role, prior to joining Blue Cross Blue Shield, I was the program director and medical director for the Texas Medicaid Wellness Program. So I had an opportunity to be all across the state in both doctors' offices and in patients' homes. I did not see any fraud when I was across the state. The people that we visited needed to be on Medicaid and needed to have the resources that we were providing through that program. I can't comment on what the legislators may think about Medicaid. I can only comment about my experience within the program, and those folks who I dealt with truly needed it. From a Latino perspective, 50% of Latino children across the country are on CHIP or Medicaid. It's a huge percentage, so it's a very important aspect of how folks in the Latino community receive care.
I think a lot of it is just perception. At least when I visit with my colleagues, it's, well, they're gaming the system. And I'll give you a real example that happened here in San Antonio. I was with my sister. My sister and her husband have adopted 6 children. I mean, from at Child Protective Services. Those adopted children have health care under the Medicaid program. My sister and her husband do okay. My sister left her job and is a full-time mom, adopting these 6 kids. One is a 4-set siblings. I went with her to the doctor checkup, and my sister drives a big Suburban. I mean, you have to with that many kids. And they're okay financially. He's a preacher at one of the mega churches here. We were leaving the doctor's office, and a person came up and said, "I'm going to report you. Look, you're driving that car and you're having that purse, and I saw you had Medicaid." How horrible for the children to witness that. They have Medicaid because it's the policy of our state that we want to encourage people to adopt. And if they would have to be responsible for all the health care, I just quickly got the kids in the car, and my sister was just in tears. You never know people's circumstances, and I think it's just perception. But unless people understand that adopted children are still on Medicaid and people in the foster care system are on Medicaid, they have this perception because they saw her driving this big car. That's what's wrong. You don't know people's situation. And what would we do without good people in this state adopting children in our foster care? I was livid and angry, but I didn't want to open my mouth because I thought I don't need to traumatize the children anymore. But I think it's things like that, and then they call their legislators. I just saw somebody with this, and I just saw somebody for using food stamps, and maybe it is that perception. So what I believe is that we really need to focus on those very few, either practitioners, providers in the system that may be gaming the system. But we've got algorithms in our payment logs now that they can really identify somebody who's seeing too many patients a day or they're billing abnormal. I mean, you know that. They should go after that and really investigate rather than spend the millions that we're spending now just to placate this perception of, oh, well, there's so much fraud in the system. I believe, like Dr. Lopez, there really isn't. There is a few, because, I mean, human nature is what it is, and in any industry you're going to have some bad players. Go after them. We can really do that in a very focused way rather than put it on the whole population. I think we'd work, if we just work smarter instead of the way that we're doing now, throwing out the broad nets with a gotcha mentality, particularly for our providers, it would be a much more effective system.